It's midnight and you're tuning into Nightline with me, Nakia Basharudin. The top stories. SPM PT Tiga among major examinations postponed due to COVID-19. And disinfection process to be conducted nationwide beginning Monday. We'll begin with our headlining story. The Education Ministry has postponed a number of national examinations, including the Sijil Pelajaran Malaysia (SPM), due to the COVID-19 outbreak and the Movement Control Order (MCO). In a statement on Saturday, the ministry announced that the written portion of the SPM, originally in 2 phases, will now be held in 1 phase from November 16th to December 7th. Originally, the first phase was to start on October 5th to 14th, while the second phase would have been from November 2nd to 19th. Other examinations affected are the centralized assessment for the Form 3 assessment or PT Tiga's Bahasa Malaysia and English language papers that are now on September 28th and 29th respectively. The Ujian Pencapaian Sekolah Rendah UPSR dates, however, remain unchanged. Also rescheduled were Matriculation Program Examination, PSPM, which will start from April 27th to May 4th, and the Malaysian University Entrance Test, MUET, which has been rescheduled to September 5th. The ministry said it would inform the public if there are other changes to the schedule. A disinfection process will be conducted nationwide beginning this Monday in an effort to contain the COVID-19 outbreak. National Security Council's Senior Minister of Security Cluster, Datuk Seri Ismail Sabri Yaakob, said the process would focus on high-risk areas of the infection.
Keutamaan dimulakan dengan public area ataupun tempat-tempat awam. Selepas itu boleh pergi ke rumah untuk nyah cemar, proses nyah cemar ini. Yang akan dilakukan segera adalah proses nyah cemar di 2 kawasan di Keluang yang kita buat sekatan yang diperketatkan.
He said this during the COVID-19 daily media conference in Putrajaya on Saturday. Datuk Seri Ismail, who is also the Defence Minister, added the disinfection process will be carried out by the Housing and Local Government Ministry through the local government authorities in the respective districts. He said in Kuala Lumpur so far, 11 disinfection processes have been carried out by Kuala Lumpur City Hall, involving 11 markets, as well as in the Sri Petaling area. At the same media conference, Datuk Seri Ismail also said that the Enhanced Movement Control Order, EMCO, will only be announced once the National Security Council and relevant ministries fine-tune the details. He also confirmed that it is not going to be a full lockdown or state of emergency.
Kita cuba bincangkan, cuba dapatkan pandangan yang lebih detail daripada kementerian-kementerian yang berkaitan supaya apabila kita putuskan kawalan yang lebih tegas ini ianya tidak terlalu menyusahkan orang ramai dan sebagainya.
Datuk Seri Ismail, who is also the Defence Minister, also reminded the public not to be influenced by fake news on lockdowns or emergencies, as it can lead to chaos and panic buying. The government will need more than 50 million ringgit to bring back Malaysians from the United States and the United Kingdom if the 2 countries implemented travel restrictions. Therefore, Foreign Minister Datuk Seri Hishamuddin Tun Hussein urged those who are still in both countries and wish to come back to fly home now while commercial flights are still available, as well as to avoid unnecessary complications later.
The commercial flights are still flying in UK and the US. So my advice to Malaysians who want to come back from UK and the US to come back now. Don't wait until, if at all, there is a lockdown in these 2 countries. and then come running back to the government and to Wisma Putra to try and bring them back.
He was speaking to the media after witnessing the handover of medical equipment from the Chinese government to Malaysia in Putrajaya on Saturday. Datuk Seri Hishamuddin outlined two issues that the government had to face in addressing the Malaysian stranded overseas problem, namely the lockdown in the host country and the allocation to charter planes to bring back the Malaysians in the two countries. The Human Resources Ministry, through the social security organization SOCSO, will implement a new initiative for workers in the private sector whose employers are affected by the economic impact of the COVID-19 outbreak, as announced by the Prime Minister through the Prihatin Rakyat Economic Stimulus Package, or Prihatin. A total of 5.9 billion ringgit is allocated to the ministry through SOCSO Employment Insurance System, EIS, to implement the wage subsidy program that will benefit 3.3 million private sector workers in the country. Under this new initiative, employers experiencing a fall in income of more than 50% since January 1st, 2020 can claim from SOCSO. For a period of 3 months, employers can claim 600 ringgit per worker. This is applicable for workers with monthly salaries of 4,000 ringgit and below who have registered and are contributing to EIS. The payment of wage subsidy will be credited directly into the employer's account within 7 days of application and approval. Employers can submit their application via the SOCSO website. In addition to relieving the burden of workers during these difficult times, the new initiative will also help employers to retain existing employees without having to retrench them in the current challenging period. The wage subsidy program will be effective from April 1st, 2020. It is an extension of the Employment Retention Program, ERP, that was announced in the Economic Stimulus Package 2020 on 16th March. As the country recorded its 27th death on Saturday, Malaysia said it is preparing for alternative care sites outside the Health Ministry's facilities in preparation for a surge of patients with COVID-19. This included preparing stadiums and expo centres to increase the current bed capacity of 5,200 beds. Late Friday, photographers showed the Malaysian Agro Exposition Serdang, MIEPS, appearing to have been converted into an alternative site for COVID-19. Health Director General Dato Dr. Nur Hisham Abdullah at his daily media briefing on Saturday said it was expected that MIEPS would be made ready for this by Sunday evening.
It's a preparation. Let us prepare for the worst and hope for the best. In case it's better for us to over-prepare than under-prepared. If we under-prepared means unprepared. So I think this is also a preparation. Then we'll use this as a model to use a hall or indoor stadium, for example, and to basically, if we need a bed. For example, today we are seeing about 150 cases or even 200 cases a day. But if the surge is 1,000 cases a day, then we have to look for beds. And our capacity now in our hospital is 5,292 beds. So we hope that that will be the first line. If we are short of beds, we'll use that bed first. So if we need, the beds are ready.
He said there were 600 additional beds available in the venue should there be a further need for beds. He added that the authorities were doing the best they could to detect possible COVID-19 cases and to conduct disinfection activities, but they were bracing for the possibility that the cases could peak in mid-April. The Health DG also noted that the 27th death recorded was that of a 61-year-old Malaysian man who had a history of diabetes and high blood pressure, while another 159 new cases have been reported, bringing the total in the country to 2,320 cases as of noon Saturday. He said that a total of 73 cases were being treated in the intensive care unit ICU, and 54 of those cases needed ventilators. Meanwhile, Brunei reported its first COVID-19 death on Saturday. According to the country's health ministry, the deceased was a 64-year-old man who had a history of travel to Malaysia and Cambodia and returned to Brunei on March 4th. The man who passed away on Friday night at the National Isolation Centre in Tutong District is the 25th COVID-19 case in the Sultanate. Brunei has reported 115 cases of the virus so far, some of which were linked to a religious gathering in Malaysia that had been attended by about 16,000 people. It was, however, understood that the man who died had not attended the gathering. The country's total recoveries reached 11 cases after 6 more patients recovered. In the meantime, the death toll from the COVID-19 outbreak in Italy has surged by 911 to 9,134, the highest daily tally since the epidemic emerged in the country on February 21st. The total number of confirmed cases rose to 86,498 from a previous 80,539, taking Italy's total past that of China. The hardest-hit northern region of Lombardy reported a steep rise in fatalities compared with the day before and remains in a critical situation with a total of 5,402 deaths and 37,298 cases. Italy is the worst affected in Europe, with almost everything having been closed in the country and people told to stay at home. On Friday, local authorities warned that restrictions were likely to be extended beyond April 3rd. The Philippines Health Ministry recorded 14 new COVID-19 deaths and 272 additional cases, marking the country's single largest daily increase in fatalities and infections. The latest count brought total infections in the Philippines to 1,075 and deaths to 68. Turkey has stopped all international flights and limited travel between cities to stem a surge of COVID-19 cases, which jumped by a third in a day to 5,698 infected and 92 dead. The rate of infections in Turkey has outstripped most other countries in the last 2 weeks, with 2,069 more cases in the last 24 hours. Over in Iran, the number of fatalities surged to 2,517 as health officials announced 139 new deaths over the past 24 hours. Health Ministry spokesperson said that 3,076 people were confirmed to have contracted the virus, bringing the total to 35,408. It was understood that more than 3,200 patients were in critical condition. The total number of confirmed COVID-19 infections in Spain has increased by almost 8,000 in one day, pushing the total number of cases to 65,700, among whom 9,444 are health workers. The Health Ministry said that the number of infected health workers in the country currently ranks as the highest in the world. Spain's death toll from the coronavirus pandemic jumped to 5,690 on Saturday, with 832 fatalities in the past 24 hours. While Australia shut down mass gathering venues, closed many businesses, and introduced the mandatory 14-day quarantine for those returning from abroad, there is no national order to stay home, although the government has said that those who can must stay inside. New South Wales, where about a third of Australians live, earlier this week introduced on-the-spot fines of more than 1,600 Australian dollars to those flouting coronavirus restrictions, while businesses could be penalised more than $10,000 if they do not adhere to strict social distancing and quarantining requirements. A Malaysian currently living in Sydney, Gan Ai Leng, shares her partial lockdown experience with us.
Australia is in second partial lockdown with only the essential businesses allowed to carry on, like supermarkets and pharmacies. But what surprised me most here is hair salons and barbershops remain open. And just like in Malaysia, we are on strict rules of social distancing when we really have to be out and about to get the essentials. Individuals who are found to breach the rules would be given fines of 1,000 Aussie dollars on the spot and possibly jail time. And now when we do grocery shopping, we no longer get the luxury of choosing the type of meat we want with limited choices, and at times what we see is empty shelves. You hardly see any toilet rolls, liquid hand wash, hand sanitizer, and cleaning agents despite the purchase limits and restrictions imposed. People are stocking up and suppliers are just not able to keep up with the sharp increase in demand. Supermarkets here used to have many items on special discounts, but we don't see that now as stocks are running low. So in general, things are getting more expensive, and what's affecting me most is I no longer shop at Eats. It is indeed getting more worrying here in New South Wales, with over 1,400 cases. Apart from overseas acquired, transmission within the community is rising as well. Businesses are suffering, shops are closing down, and people are losing jobs across the globe, and no exception here in Australia. As for schools, they remain open here in New South Wales, but parents get to decide whether or not to send their children to school. We chose to keep our boys, Marcus and Marvin, at home, and they get hungry 24/7, but that's okay. We feel much safer to keep them here, and they continue to learn online. And due to the ongoing pandemic, our flight plan back to Malaysia in mid-April for Term 1 school holidays has also been cancelled. It is going to be a very different school break for the boys. We're expecting tougher lockdown measures to be announced by the Australian government soon to stop the spread of the COVID-19. So for now, like what you are doing back at home, we continue to do our part, stay home and do the right things to fight through this together. Stay home and stay safe, Malaysia.
After an initial relatively slow spread, the number of infections in Australia has been rising quickly in recent days, climbing to 3,166 confirmed cases of COVID-19, with 13 recorded deaths related to the virus. Working for us in the face of a deathly pandemic are the legions of workers on the front line in our health service and other essential services. Doctors, nurses, cleaners, caterers, first responders, retail staff, and all the rest who are described as the frontliners in the combat against COVID-19. The Malaysian government has been relentless in its efforts to secure a very high level of civic awareness and voluntary cooperation that strengthens collective effort to ward off the pandemic. It is not easy to contain the virus if the people do not consider themselves as the first line of defense to keep a lid on infections. Besides China, the experience in Europe and the United States represents a warning to countries that still have time to contain the contagion. In Malaysia, the compliance level of the Movement Control Order (MCO) put in place since March 18th stands at 97%. However, 482 were arrested for defying it, and that's within 48 hours. Despite warnings across the board, some people are actively ignoring the experts and going on with life as usual. Children and young people appear unlikely to develop serious symptoms, but they can still be carriers of the deadly virus and pass it on. Many healthcare workers understand what they are up against. For some, like Dr. Michelle Au, an anesthesiologist from Atlanta, she felt always being the last line of defense taking in when everything else failed. During the COVID-19 pandemic, Dr. Au is responsible for one of the most dangerous parts of tending to patients with the coronavirus, intubating those who can't breathe. Those invisible risks that she has to face daily, a trace of the coronavirus, for example, do not give Dr. Au nightmares just because she is worried about her own health and that of her colleagues. It's because waiting at home are her husband and 3 children. For 2 weeks, she has slept in the basement while her husband, a surgeon, sleeps in their bedroom because one of them has to stay healthy.
Many have referred to healthcare workers as working on the front line of this epidemic. I understand this terminology, and the inclination to use wartime metaphors in this moment is apt. However, one thing needs to be made clear. We are not the front line in this battle. We as healthcare workers stand in the back. We are the last line of defense, and we hope the fight never gets to us. The front line of this epidemic is you, the people in the community tasked with the challenge of keeping us all safe. The history of public health is a story of prevention. Public health is about preventing larger problems before they happen. And we need you on the front lines to help stand guard. You do this by social distancing and preventing community spread in every way possible. You do this by cleaning and sanitizing. You do this by applying quarantine when indicated. And hopefully, eventually, we'll add to this list vaccination as one further public health measure in this fight. So thank you for standing on the front lines for us. And know that all of us on the last line of defense appreciate anything you can do to help. Be safe and take care of each other.
We're taking a short break. When we return, woman remanded for insulting police on Facebook. Stay with us. Welcome back. A woman in Padang, Kedah was remanded for 2 days after she uploaded a status to her Facebook page, which was deemed to be insulting police. According to Padang District Police Chief Deputy Superintendent Ariz Sham Hamiza, the woman was reportedly fuming at officers after she was stopped at a roadblock in Batu Menunggul at 9 p.m. on Friday. The woman then uploaded the offensive social media post after being advised to turn around and head home. She was arrested at her home at 11:30 p.m. The case is being investigated under the Communications and Multimedia Act 1998. This is the fourth arrest in Kedah under the Movement Control Order period. Now moving on to the foreign front. 2 intelligence officers at Iran's consulate in Turkey ordered and coordinated the killing of an Iranian dissident who criticized the republic's political and military leaders in Istanbul last November. According to a report citing 2 senior Turkish officials, Masoud Molavi Vardanjani was shot dead on an Istanbul street on November 14, 2019, a little over a year after the Turkish officials say he left Iran. A police report into the killing published 2 weeks ago said Vardanjani had an unusual profile. It said he worked in cybersecurity at Iran's defense ministry and had become a vocal critic of the Iranian authorities. According to the report, Vardanjani had posted a message on social media targeting Iran's elite Revolutionary Guards in August, 3 months before he was shot dead. The accusation is likely to strain ties between Turkey and Iran, 2 regional powers which had grown closer under the government of Turkish President Tayyip Erdogan. Now let's take a look at what has been installed on the front pages of Malaysia's main newspapers for Sunday, March 29th. All 3 main newspapers, the New Sunday Times, Harian Metro and Berita Harian, highlights the nationwide disinfection exercise which is set to take place on Monday, and the postponement of major examinations due to the spread of COVID-19. Do get your copies today. And residents of a French apartment block have decided to beat the COVID-19 lockdown blues by organizing a communal exercise class from their building's raised walkways. Start jumping at a safe distance. Physical exercise is permitted in the country, but only for an hour a day within a kilometer of home and only with members of the same household. The visuals of the lunges against lockdown wrap up Nightline this time around. With that, I'm Nakia Bashiruddin. Thank you for watching, and to all Malaysians, stay safe and do stay at home.